Mm-hmm.
Okay. Hello, Dr. Jackie. This is Terry Long from Spotlight Over the City. Thank you so very much for joining us this evening. We are very excited. We're glad to have you and very appreciative of the opportunity to get to chat with you. We have a lot of viewers and listeners who've been hanging out, waiting patiently for us to get you on the phone. And just wanted to start by saying welcome and thank you.
Thank you. Thank you for having me.
And everyone wanted to let you know, they said, please let her know that we all watch you so religiously all the time. And we love Dr. Jackie here in the DMV. We're in DC, Maryland, Virginia area. We love Dr. Jackie.
Well, tell them thank you. I need all the love I can get this season.
I know that's right. We love it and we support you 1000% here in this area. But so that I don't keep you too long, I wanted to also let you know that we did a hour show right before we got you on with two wonderful young ladies who are also we learned a new word and they're thrivers. We have thrivers and warriors in the building with us also tonight. We have Benita and Juliet, two wonderful women who have gone down this same path, and they are here with me to talk to you tonight, Dr. Jackie. So I wanted to welcome Benita and Juliet as well.
Welcome.
Hi,
Yes.
Dr.
Thank
Jackie. Hi,
you.
Dr. Jackie. So
Thank
listen,
you.
we have some great questions for you. I think that we were able to send you some things in advance, but I'll just get right into it so that we don't keep you all night on the phone. Wanted to first start by sharing with you that both Benita and Juliet. Juliet is still going through her treatment, and Benita, your situation is that she went through hers, and you are
Clear.
clear. She got a clear
Amen.
diagnosis.
Yay.
Yay, right?
Thank you. Thank you. Thank you.
Yes.
Yes. And so we learned through reading about you that you were diagnosed with stage 1 breast cancer in 2004 by way of a routine mammogram. Can you tell us and our viewers and listeners a little bit about that day, Dr. Jackie?
Yes. I actually was pregnant and had a loss, a miscarriage, and thought that I needed to make sure I did all of my preventive health. I went in, I had a routine mammogram. And of course, as a physician, I got a phone call and I'm thinking, they do this to everybody. No big deal. I'm going to go back in, get the follow up. And I thought it was just that simple. And of course, at the follow up, I was asked if we had time to do a biopsy, but I was trying to get the surgery myself as the surgeon, and I delayed it for a few hours. And later that day, ran into one of the breast surgeons who offered to do it after hours. Had a breast biopsy on a Friday, husband out of town, hanging out with the girlfriends, which we call girlfriends gone wild weekend, which was shopping and eating and having a good time. And on Monday, instead of waiting on the phone call, I decided I would make the phone call because guess what? I'm a doctor, breaking all the rules, and called the pathologist to get the pathology report. They did tell me they called me back twice. And on the third call, it's like, okay, I need to speak to somebody. The pathologist did call me back and tell me that I had infiltrating lobular carcinoma. Now, as much as I knew what carcinoma was at the moment they told me I had infiltrating lobular carcinoma, I really did go blank, like, okay, what's that? Because I was in a state of shock. I had no family history, I had very few risk factors, and I just didn't expect that. And so, of course, processing what I heard, I ended the phone call. I continued to see patients. And shortly after, by the third patient, I'm having these crocodile tears and I'm in disbelief. And so I cut my day short. I called my husband, I called my family, and there we were, trying to say, okay, what do we do now? As I think every breast cancer warrior has said, it's you are frightened, you're unsure what's next, and there we are. I'm now in a whole new sorority. I hate to say it like that, but I'm with a group of girls that none of us chose to be in, but
Yeah.
here we are.
Yeah, yeah, yeah.
Absolutely.
Wow, your story, Dr. Jackie, is just it's I was sitting here tonight with these two young ladies. Just we were all in tears at some point on the set. Just these stories are so inspiring, but yet also for someone like me, you know, just learning about this is just, it blows me away. Some of the things that
Yeah.
women are, women go through. Not that men don't go through things, but it just blows me away. What were some of the immediate decisions you had to make about your life post diagnosis?
Well, if everybody would be honest, or I should say, if I would be honest, the first thing in a woman's mind usually is the fear of dying.
Mm,
We often equate breast cancer and death as, oh my God, is this unto death? And so I had the initial human response like, oh my God, am I dying?
yeah.
But then I had to start thinking, what do we do now? Because I think as a physician, I always tell people I was on both sides of the knife. I knew a lot because I'm a physician who takes care of women. And I knew as a patient, I had to make some decisions. So I immediately saw the breast surgeon on the following day and just learned my options. I even did my due diligence and got a second opinion because these were friends. And I wanted to hear from another hospital, another set of doctors, all of my options, and needed to make decisions that were right for my life. Whether it was a lumpectomy, a mastectomy, or whatever it was going to be, I wanted to hear all of the pros and cons of those uh, options. And that's what I did. I mean, I listened, I understood the risk of this surgery, I understood the benefit, and I understood the indication. So there we were down a path of making the right decisions because, my quest was I wanted to be a mother. So I
Yeah.
needed to get this behind me so we could go back and work on being parents.
Wow, wow, wow. I praise you for your strength, and people often think, Dr. Jackie, because you're a doctor, these types of things wouldn't happen to you, but that's so false. There's a misconception out there that doctors are somehow immune to these types of things, but you're living proof that doctors are human beings, and these types of things happen to you all as well. And you've gone through a lot. You know, that's a lot.
Yeah,
That is a
yeah.
lot. We know that you initially had a single mastectomy and then later a double. Is that the best course of action for women who are diagnosed with breast cancer, or are there other different stages as to when a doctor would advise a woman to have a mastectomy?
Now, actually, the first time I had breast cancer, had a lumpectomy where they
Okay,
just removed the area.
okay.
And, after that, I had a second lumpectomy because the margin wasn't clear. There has to be a certain amount of clear tissue around the area. And so I had a lumpectomy and a second lumpectomy, which was followed by chemo and radiation.
Mm,
And, there certainly are treatment options, and I definitely want to encourage every woman to know that there now with the technology, you don't have just one treatment. But it depends on the stage, it depends on the lymph nodes, it depends on many other risk factors you may or may not have as to which surgery is right for you. And obviously at stage one, I had the option of being very aggressive and removing my breast or being a more conservative and doing a lumpectomy. And I thought, no family history, very few factors, and there's a 96% survival rate if I do a lumpectomy. And that's what we did the first time is a lumpectomy.
okay, okay. Wow. Okay. Well, how about your personal experiences dealing with infertility as a result of breast cancer? Is it the chemo treatment that causes the infertility, or the cancer itself, or a combination of both?
Well, it was the type of chemo that I had, which actually affected the ovarian tissue and caused destruction of those follicles. Now, you have to remember, I was more mature. After a couple of birthdays, I don't say older anymore. I was a lot, I was actually 40. And when I was diagnosed the first time, and at that point, you're starting to lose some of your ovarian reserve anyway. So being 40, having chemo, actually destroyed the follicles that I had left. So yes, breast cancer indirectly caused it, but direct cause was the chemo.
Wow, wow. What has kept you motivated and inspired to keep living your best life as we continue to see you do so well, Dr. Jackie?
I do believe that as God did, and He created the world with His words, that we create our own destiny with our words. So I worked really hard to make sure only life came out of my mouth. I
Yes.
read the right
Yes.
material. I would listen to tapes, and I found a book, and I held on to the scripture that said, I will live and not die. Because I do believe my thoughts, or I should, everybody's thoughts sound like real words. It's almost like somebody speaking to you, and you would hear the thought, "You're gonna die, you're gonna die, you're gonna," and I was just not wanting to hear it. So I started using my words. If my thought came to my head, I'm gonna die, I would speak back to the thought as if it were another person in the room. And so I used my thoughts. I read books. I found scriptures. There was a book that had all of the healing scriptures in the Bible in one book. And
Oh,
I used everything I could to empower myself so that I stayed positive, because I do believe if we stay focused on positivity, positive thoughts, positive words, positive actions will lead to positive destiny. So that's what I use.
Dr. Jackie, what's that book that has all of the healing scriptures? Do you remember?
It's a book written by Kenneth Copeland.
Kenneth Copeland.
And
Okay.
I don't know the name of the book, but I do know the author was Kenneth Copeland, and he has a book that has every healing scripture that is in the Bible was in this book, and I would use them to just kind of fill myself up. And I'm not lying to anybody to say I never had any fear, and I was walking around happy. No, I was human, and I would go to the doctor, and I would hear them say, "You got to do this, and we got to do that," and it would steal my joy for a minute, and I would have to go back home and fill myself back up by reading different books. And just normal human positivity
Yeah.
was some of the stuff I used too, just to remind myself. I wrote out things, I will live and not die, my body is the temple of God. I would just find stuff to make me feel better, and and if you say it long enough, the brain has to go with what's coming out
That's
of your mouth.
right. Yes, that is so right. So who or what did you consider to be your biggest support system throughout your treatment and just overall during the times you were fighting through this illness, Dr. Jackie?
The one thing about that journey, and I do think breast cancer is a whole journey, is I was surrounded by so much love and, flowers, cards, foods, visitations. But my husband obviously was the one person who was there for all of my chemo and who was there with my surgeries. But I have great family support. I have fantastic best friends. And then being a physician in the hospital, I'm surrounded by my colleagues who, of course, made exceptions to the rule
Yeah.
and would love on me more than ever.
Yeah. For women who are diagnosed with breast cancer, what are your top three pieces of advice for them? And then also, what about the women coming out of treatment with cancer free diagnosis? What advice would you have for those ladies?
Well, for a woman who has been given a diagnosis of breast cancer, and I always say given a diagnosis and not call it my breast cancer because I didn't want to make it me.
Yeah,
But a
yeah,
woman who has been diagnosed with breast cancer, one, know your disease process. Know what type of breast cancer you have. Know what stage of breast cancer you have. Know your treatment options. So know your disease process or the disease process. And then secondly, as part A to that or B to that is to know the treatment options. And then second is to find a way to empower yourself and inspire yourself, as we just spoke about, so that you remain positive. Because I think when we feel good, the immune system knows that we are empowered immune wise to fight the disease. And then thirdly, live like you want to live. Eat live, exercise, watch your weight.
yeah.
Do all the things you need to do to take care of yourself.
Mm. Um, I got about two or three more questions, and then we are going to let you enjoy the rest of your night, Dr. Jackie.
Hmm.
What
And
obstacle?
for a woman,
Go
you
ahead.
asked me for the
Oh,
woman
that's
who
right,
is
for the women with
disease.
cancer-free
Yeah, a
diagnosis.
woman who is disease free is to live like you never want to have breast cancer again. And that again goes back to you are what you eat. So make sure you're eating as healthy as you can. And I say that because I'm not saying you should never have a cheat day because I love French fries. But I have to, I do things in moderation.
Yeah,
And I think you have to eat, if you didn't kill it or grow it, it's not live. So egg, nuts, meats, beans, things that we had that had life. So
Yeah.
definitely eat live. Vitamins to imp- empower your immune system even more. And then the other part of life is to enjoy it.
Yeah.
Yes.
Do things that make you laugh. That is medicine to the body, is to be able to laugh and be happy. So if it's toxic to your mind, it's toxic to your body.
Oh, I love
I
you. I
love
just love
that.
you, Dr. Jackie. She is. I mean, it just
Yes.
all of her responses just fills me with like these goosebumps. You know what I
Yes.
mean? What
hmm
what obstacles did you face throughout your journey, and how did you overcome them?
Well, the first obstacle is just getting through the whole journey, because
Yeah.
the woman who goes through that journey, chemo, radiation, surgery, and surgery again, and then double mastectomy, that's a lot for the female body.
Yeah.
And you lose two of the most defining things as a woman. You lose your hair and you lose your breast. And those are the two things we identify with physically as a woman. And so just getting through that journey of not having those things and knowing that it's going to be okay is is the process.
Yeah.
And then I, of course, would always, I let me go back to it. I just say, stay true to who you are, though. If you want to live, you have to do things that will keep you alive. And you can't go back to your old ways. You have a new norm. You had breast cancer, you don't have breast. You're a new person and you need to take care of your body like you would a new car. When you get a new car, you make sure not a scratch on it, you can't eat in the car, you can't drop it.
Yep.
You just
Yep.
got to take care of this new norm like you want it to stay alive for the rest of your life. So eat live, exercise, everything I keep saying is do those things you need to do to take care of yourself.
Absolutely. Tell us a little bit briefly about your 50 Shades of Pink Foundation, and if there's anything in the DMV area that we can do to help support that or push that movement along. Just make sure you say the
Okay.
word. Let us know.
50 Shades of Pink Foundation is, of course, a foundation that I started after my first diagnosis, and well, after really my second diagnosis, because I would dress up to go to chemo. I needed that mentally, and when I say dress up, is I would wear some cute little warm up suit, put some lipstick on, and just wanted to feel good. Because I think when a woman looks good, you know how you feel on
Yeah.
Sunday when you got your Sunday best on.
Yep.
You feel good, and
Yes.
when a
Yes.
woman feels good, looks good, she feels good, and when you feel good, you ultimately will do good with your immune system. So I started this foundation where I took care of the woman who had the disease. Whether it's lipstick, fingernail polish, robes, warming blankets, journals, because I do think journaling is a part of the journey, because the journaling really isn't for you. I would go back and look in the journey because I needed to tell people on that third chemo treatment is when I started to feel super nauseous. And this is when I was crying because I smelled food cooking and I couldn't eat it. And so anything that I did to get me through that journey, I would package in a basket and give it to a woman who's been diagnosed with breast cancer. And so that's what we do at 50 Shades. I call it the vanity part of the journey, is
Wow.
we take care of the woman with the disease.
I love it. I love it. Listen, um, anything that Spotlight Over the City can do to help this 50 Shades of Pink Foundation get the word out, just know that we are here for you, Dr. Jackie. We consider you now a part of our Spotlight family. So that's when we mean that from the bottom of our heart. If you're ever in the DMV area, we would love to sit down with you and in person one day. And we love you, Dr. Jackie, here in the DMV area. And I'm very,
Yes.
very grateful that you took time out this evening to talk to us. I just have one last question, and this is off topic, but my husband is in the studio. And can you just tell him from an OBGYN's perspective, Dr. Jackie, that just because I'm 49 doesn't mean I can't still have one more baby with him? He says that I'm too old. I've had 3 C-sections. I'm not too old, right, Dr. Jackie? I still got all my stuff in there.
Well, let me start with girl power first, because I love you. But you asked me in front of your husband, and so I have to tell you that there may be a few challenges at 49,
Yeah.
in that the there's a 25% chance that a reproductive age woman can get pregnant every month. So 25% chance. After 35, the number starts to drop a little bit. After 45, it's only about a 5% chance.
Oh
And
man.
so after 50, your chance. Now, I'm not saying no because my oldest OB patient was 48 years old.
Yes.
And
See.
she actually had a oops, and she was not happy about it. But but you can get pregnant about 1% chance every month.
I got a 1%. Okay, well, he's smiling because he's like, just get over it. So
Right.
we've got.
So listen. If you could play the lotto and try to get pregnant every month.
Okay, I'll take that. I take that. Listen, again, we're going to let you go, Dr. Jackie. And again, let us know anytime you need anything from us up in this area. We got you covered. We love you.
Super duper. Thank you so much. And you guys have a super fantastic night.
All right, you too.
Good night.
Good night.
Thank you.
All right,
okay.
bye-bye.
Bye.